Hello, this is Dr. Eric Bricker, and I'm back in the phlebotomy lab area here at the Frontier Direct Care Clinic. And what I want to do is I want to show you the actual vials when the blood is drawn here, what those different vials are and why they are important. Okay, so here we have these different colored tops, right? So we have light blue. These are called a tiger top because it kind of looks like a tiger. And then we've got purple, and then we've got dark blue as well. And then we've got a chart here that shows how it corresponds, okay? So now this is super important because probably the most common one you're gonna have here is this tiger top, because you can see that there's actually a gel in the bottom of there that actually helps the blood separate, because you actually want to separate the blood in this particular vial. There's different chemicals in each of the vials. That's why there's different vials that you have to fill, okay? And this one, it gives you your basic metabolic panel and your comprehensive metabolic panel. But look at this, it also gives you your lipid panel for cholesterol screening. Look at this, it also gives you your T3, T4 thyroid stimulating hormone as well, because that's super important, because testing for your thyroid is also something that we can do here in the clinic. Now, the other one that is super important is here we have the lavender top, and the lavender top here is used for your complete blood count. So that's when they're figuring out your hematocrit, or your hemoglobin, and your white blood cell count level to see if you have an infection, and your platelet level as well. So just know that there are tons of laboratory tests, and you can actually see, let me see if you can see it on here, how there's a very small sort of film on the inside, okay? And that film is specifically the EDTA that is used to treat that blood, which is different from the gel in the tiger top, which is used to treat the blood differently. So that when the lab gets it, they can actually process it correctly. So that's why when you go to the lab, they have to draw all these different vials, because they have different chemicals in them that allow different tests to be done. And we can do all that here in the Frontier Direct Care Clinic. Thanks so much for watching.